Do not stop any medication after watching this.
Okay.
By the end of this video, you will know exactly what your pills are taking from you and how to protect yourself.
Right now, somewhere in your medicine cabinet, there is a pill that is doing its job perfectly. And at the same time, taking something from your body that no one told you about. What I am about to share with you involves 4 specific medications, each one backed by published clinical evidence, and each one draining a nutrient your body cannot afford to lose after 60.
Let me start with a medication that is sitting in almost every medicine cabinet in this country right now.
Let me start with the one that shocked me the most in my own practice, Omeprazole. This single medication accounts for over 15 million prescriptions every year in the United States alone. Chances are someone in your household is taking it right now. It works by shutting down the acid pumps in your stomach, which is exactly why it relieves heartburn and acid reflux so effectively. But your stomach acid is not just there to bother you. It is the gatekeeper that allows magnesium from your food to actually enter your bloodstream. When you suppress that acid for months and years, magnesium absorption drops quietly, and your body starts running on empty without giving you a single
And this is not my opinion, Twell. The FDA itself had to step in and issue a public warning about this.
In 2011, the FDA issued an official safety warning stating that long-term use of proton pump inhibitors can cause dangerously low magnesium. A systematic review published in the International Journal of Molecular Sciences found that patients on long-term PPIs had a 50% increased risk of bone fractures because low magnesium and low calcium together weaken your skeleton from the inside. And it does not stop at magnesium. Omeprazole also blocks proper absorption of vitamin B12, with clinical studies showing up to 20% of long-term users becoming B12 deficient. That means 1 out of every 5 people taking this daily pill could be losing the very vitamin that protects their nerves and keeps their brain sharp without ever being tested for it.
What I am about to tell you next is something I wish someone had explained to my diabetic patients 10 years earlier.
The second medication hits even closer to home because the people taking it are already fighting a disease that attacks their nerves every single day. Metformin, the most widely prescribed diabetes medication on the planet, used by over 100 million people worldwide. Metformin does an excellent job of controlling blood sugar, and I want to be very clear, it saves lives. But a landmark study published in the World Journal of Diabetes followed thousands of patients on long-term metformin therapy, and what they found should be a wake-up call for every doctor. The prevalence of vitamin B12 deficiency in metformin users ranged from 6% all the way up to 50%, depending on the dose and duration.
This next part is something I have personally seen in my practice, PFO, and it changed how I treat every single diabetic patient.
And here is the part that stays with me. The study showed that the neuropathy, the tingling, the numbness, the burning in your feet was significantly worse in metformin patients who had low B, which means many diabetic patients are being told their nerve damage is from diabetes, when part of the damage is actually being caused by the very medication they are taking to treat it. The UK government even updated its official drug safety guidance, stating that decreased vitamin B12 is now considered a common side effect of metformin. Yet in clinical practice, routine B12 screening for metformin patients is still not standard, and that gap is where real people fall through.
If you have ever felt unexplained muscle soreness or a fatigue that sleep does not fix how, pay very close attention to this next section.
Now, if you are over 60 and you have been told your cholesterol is high, there is a very good chance you are already on this. Atorvastatin, brand name Lipitor, is prescribed to lower cholesterol, and it does that job very well. But statins work by blocking an enzyme in your liver called HMG-CoA reductase. And here is the problem. That exact same enzyme is responsible for making coenzyme Q10. CoQ10 is not some supplement trend. It is the molecule that your mitochondria use to produce energy inside every single cell, especially your heart muscle cells.
What this study found is something I believe every patient on a statin deserves to hear.
A study published in the Archives of Neurology found that even brief exposure to atorvastatin at 80 milligrams per day reduced blood CoQ10 levels by approximately 51%. 51%, cut in half, the very fuel your heart depends on to beat with strength. And the American Journal of Cardiology published a study showing that patients who supplemented with 100 milligrams of CoQ10 daily experienced a 40% decrease in statin-related muscle. So the pain was not a mystery. It was a deficiency created by the medication itself.
This last medication affects something so fundamental that your heart rhythm depends on it, every single beat.
The last medication on this list drains something so critical that losing even a small amount can make your heart skip in ways you will physically feel. Hydrochlorothiazide, one of the most common blood pressure medications prescribed to seniors, is a thiazide diuretic. It works by forcing your kidneys to flush out extra sodium and water, which brings your blood pressure down, but it takes potassium and magnesium right along with it. A review in the journal Hypertension found that with moderate to high doses of thiazide diuretics, the incidence of low potassium ranges between 20 and 40. That is not a small number. That means up to 4 out of every 10 patients on this medication could be walking around with dangerously low potassium. And potassium is the mineral that keeps your heartbeat stable. The same review confirmed that the risk of cardiac arrhythmia, irregular and potentially fatal heartbeat, is directly proportional to how much potassium your body has lost. And because diuretics also deplete magnesium, and magnesium deficiency makes potassium depletion worse, you end up in a double deficiency that compounds silently.
So now you have seen what each pill does inside your body per bow. Let me show you how these 4 work together against you.
So now you have seen all 4. Omeprazole drains magnesium, B12, and calcium. Metformin drains B12. Statins drain CoQ10. And diuretics drain potassium and magnesium. And many of you watching right now are on 2 or even 3 of these at the same time, which means the depletion is stacking up inside you in ways no one has measured.
I want to be very clear right now. Nothing I have said today means you should stop your medication to bed, but you absolutely must protect yourself.
So what do you actually do with this information? Because I need to say this clearly. Do not stop any of these medications on your own. What you need to do is walk into your next doctor visit and ask for 5 specific blood tests: serum magnesium, serum B12, methylmalonic acid, which catches hidden B12 deficiency, a CoQ10 level, and serum potassium. If any of these come back low, your doctor can adjust your supplementation without changing your medication. And that one conversation could prevent years of unnecessary damage.
If you remember nothing else from this video, remember this one thing.
The medications are keeping you alive, but if you do not know what they are taking from you, they could be quietly making you sicker in ways that nobody is watching. Take this list, bring it to your doctor, and protect the body that is working so hard to carry you through every